Can you walk us through what happens if there's a positive case in a school setting in our area?
So if we get notified of a school-aged child that's tested positive, our first concern is, did the child go to school? Was there an exposure in the school setting? And so we have dedicated school teams. So these are public health nurses that are linked to one of the 95 schools that we support. So we have around 10 people in this team supporting 95 schools. We would, as we would with any test, first confirm it's the right patient, the right age, and it is indeed a positive case. We then do a risk assessment. The vast majority of cases in our experience, in Ontario, have not picked the virus up in the school setting, but actually in their family setting, because that's where you're typically not wearing the mask, where you are in very close personal contact, spending a significant portion of your day in close proximity to others. So really our first assessment would be, is there anyone else in the family setting that has any symptoms of COVID-19? And we would offer testing certainly to all of these high-risk close personal contacts. We then try to get from the family a better understanding. Has there been recent travel? Have they been in contact with anyone with symptoms compatible with COVID-19 of fever and or cough and or increased shortness of breath or loss of taste or smell? And we want to know when this person's symptoms started, because we know you're infectious around 2 days before your symptoms start. So we'd want to ascertain if there is anyone else at risk within the school setting. This child would be off for 10 days because we know you're not infectious after 10 days. And then we start looking at the school setting of the risk in the classroom, given that this person is typically infectious before they develop symptoms. And that's, in our experience, when children have gotten to school. They haven't been going to school when they have symptoms. It's the 2 days before they develop symptoms. Once we've done this complete risk assessment, ascertained the risk in the family and in the school setting, we would then come up with a testing strategy of whether we have to test the high-risk contacts in the family setting and or any other contacts and or within the school. At a minimum, for 14 days, the children in the cohort of that individual would be off and they'd be monitoring their symptoms. And we would test if any of the children that were in contact with this individual developed symptoms, and that would be at one of the assessment centers. And sometimes, if there's good lab capacity and not a backup, we would suggest to children and parents to get a clearance test. So even if you've had no symptoms during the 14 days we're monitoring you, at day 10, if you're going to be positive and have very low symptoms or have no symptoms, we should be able to detect that. So we would suggest in many instances to get testing at day 10, even without symptoms. We then collect the information for all the children in the cohort of this child, all the information from the family and the school setting and the work setting, and if everyone's okay and all the basic precautions have been taken, we'll give a green light to all those that have been in quarantine to be able to go back to school. And that would be working with the school board, the families, the parents, and the workers in that environment. So you can see it's a significant amount of work, but we're up for the challenge. And this is a very similar approach that we'd have to take for any high-risk congregate setting.